Hello, this is Medical Science Lecture Room. I'm delighted to have you here. Today I would like to share with you on how to prevent unwanted pregnancies or how to prevent unintended pregnancies. Just to inform you, in this channel, I give medical tips or medical education to my esteemed viewers at the comfort of their living room. I also run classes for students of physics, chemistry, and mathematics. In case you're new to this channel, please hit the subscription button, turn on your notification bell so that once new videos are made, you will be first to be notified. Again, share and like this video if you find value. Let's begin. Welcome back. Like I said, today I would like to discuss with you on how to prevent unintended pregnancy or unwanted pregnancy. There are many ways you can actually prevent unwanted pregnancies. Some of these ways or some of these methods are things you can do by your own self at the comfort of your home, while there are some other ways or methods that require you to seek the help of a medical practitioner or healthcare giver. I will begin with those methods that you can take care of at home by your own self. We have the method of barrier, which we call barrier method. The barrier method works by preventing the entry of sperm into the woman. Here we have condom. Condom, we have two types. We have the male condoms, we have the female condoms. The male condoms make up about 80% effectiveness, while the female condom is about 79%. These two methods can help you prevent pregnancy that is not intended and also prevent sexually transmitted infection. We also have the diaphragm. Diaphragm is a device that is inserted into the vagina of the woman, and sometimes you may have a spermicide. A spermicide is a chemical that inactivates the sperm. And so if you use a diaphragm with the spermicide, you're sure of 90% effectiveness in prevention of pregnancy. But again, you need to know that spermicide or diaphragm do not prevent sexually transmitted infection. We also have cervical cap. The cervical cap is another device that can be placed inside the woman at the level of the cervix. Again, it acts by preventing sperm from entering into the uterus or into the body of the woman. These, of course, constitute about 71 to 85% effectiveness in preventing pregnancy. However, it does not equally prevent sexually transmitted infection. We have the method we call this use of spermicide. Like I said earlier, a spermicide is a chemical oil that inactivates the sperm. In most cases, it can be injected into the woman as well. And the spermicides constitute about, it's effective, when you use a spermicide, you're sure of 75% efficiency. I want to again inform you that in all of this method, you can get them over the counter. We also have the one we call, a part of the barrier method is the contraceptive sponge. So we have about 6, the condom, which of course I said the male and female condom. We have the diaphragm that can be used with a spermicide. We have the spermicide when it is used alone. There is also contraceptive sponge and the cervical cap. This method constitute the barrier method of pregnancy prevention. Like I told you earlier, of all of them, it is only the condom that prevent both pregnancy and sexually transmitted infection. But the rest do not protect you from infection. Now, besides this barrier method, we also have the hormonal method. The hormonal method, you can't get them over the counter. You can only use this method following prescription from prescription by an healthcare provider or your doctor. We have the method, the following make up the hormonal method. This method acts by preventing what? Ovulation. Of course, ovulation is the release of the egg from the ovary into the fallopian tube of the woman. So what happens in this case is that these drugs, this method prevents the egg from being released. And once the egg is not released, of course, there can never be fertilization. And if there is no fertilization, therefore, there will be no pregnancy as well. So we have what we call the contraceptive pills. The contraceptive pills, there are two types. We have the combined contraceptive pills. Here we have the combined contraceptive pills, and we have the combined contraceptive pills consist of progesterone and estrogen. We also have the other one, which is also part of the contraceptive pills. Here, this one is known as progestin only contraceptive pills. That means it has only progestin. Now we also have what we call vaginal ring. The vaginal ring, more or less, a device that can be inserted into the vagina, and it releases hormones that will interfere with ovulation. There is also injection. Injection, here we have the Depo-Provera injection. Remember, we said that this method can only be used following prescription by an healthcare provider. It therefore means you cannot get them over the counter. You can as well use it all by yourself. We have another method you can possibly use by yourself. We have the natural method. The natural method requires that you understand or know the length of your menstrual cycle. If you know the length of your menstrual cycle, you know the date the egg will be released, which is the ovulation day, and then from there you can possibly know your fetal window or the safe unsafe period. If you know the safe period, unsafe period, you are good to go to prevent pregnancy. Why? Because you can now have sex at the date you are safe. So this is a natural method of pregnancy prevention. Of course, you know that of course will not prevent you from sexually transmitted infection. Now, this is the natural method. We also have another method, which is emergency birth control. The emergency birth control is when after sex, within 3 days, it can be used. And in most cases, you use it when the either condom have failed, it's broken along the line of sexual activity. Then you can quickly go for emergency contraception. And of course, most drug that is commonly the drug that is commonly used is your postinor. Of course, postinor contains levonorgestrel, and so this is what you can possibly use to take care of or prevent pregnancy when there has been unprotected sex. Then we also have sterilization method. The sterilization method is more or less a surgical procedure. Here, this method is never recommended for people or young girls who are within the reproductive age, because it may prevent them from getting pregnant at future date. So this method involves ligating the tubes, in other words, sealing the tubes. And once you seal the tube or block the tube, it prevents the egg that has been released from the ovary from entering into the fallopian tube. And so that can never be reversed. It's best for people who have had their children and they don't want to get pregnant anymore, they can go for that. But for young girls who are within the reproductive age, or girls who are within the reproductive age, it's not best for them, because someday they want to get pregnant, and when that time comes, they cannot get pregnant, because that may never be reversed. For the guys, they may do what we call vasectomy. Of course, that's another sterilization method. So that's why we say this method is a surgical procedure. It's not what you can do at home. You will need to go to the hospital. Perhaps sometimes you will need the medical professionals to carry out this method for you. So with all that I have said, it is now clear that the barrier method and the natural method are the methods that can be used by you at the comfort of your home. You can get that if for the barrier method, like I said, you can get them over the counter without prescription. But for the mention the method of IUCD, what we call intrauterine device. That again is another method. How it works is that it releases copper ions because the device is inserted into the uterus of the woman, and it releases copper ions. Copper ions will interfere or inactivate sperm when sperm is released. That's another method, but it can never be done by you. You need to go to the hospital to have that done. So I have identified over about 15 ways. Like I told you, the barrier method, about 6 of them can be done by you at your in your house at home, but the method of hormonal cannot be done by you. You need to seek what medical help, as well as the method of the IUCD. You can't equally do that by your own self, but the natural method as well as the barrier method are the commonest method you can possibly do by yourself. So I want to believe you have understanding of this, and if you have any question, if you have any comment, please drop them at the comment section. Also, do not fail to like this video, share, and subscribe. Thank you.